A good part of the debate about health care reform centers on two words: who benefits? Well, let's look at what Americans say. We asked them just that question about the U.S. healthcare system in general across the country, and also them personally. Would their health care benefit? First of all, very broadly, the question asked about medical care. And look at the results for the United States. It is a plus. That is, more people said that health care reform would improve rather than worsen U.S. medical care. But notice this isn't a thrilling result for advocates of health care reform. Just 44% say that health care reform would improve health care in the U.S. in general. But still, those results shine in comparison to the same question asked about your health care personally. Look at those numbers there. More Americans say that health care reform would actually worsen their personal health care, medical care, than say that it would improve it. So Americans are not at all convinced that health care reform would help them personally. Now, the other question we asked along these same lines was access to health care. And here we have a little more positivity when we ask about the healthcare system in general across the U.S. 47% say yes, healthcare reform would improve access for the U.S. as a whole. Only 29% say it would make it worse. But again, look at the same results when we ask about your personal access to healthcare. Again, it is a net negative. Americans say that healthcare reform, if passed into law, would actually make their personal access to healthcare worse. Finally, there is something that Americans agree on in terms of both the U.S. in general and them personally. Healthcare reform would increase rather than decrease cost, and I want to emphasize that. A lot of the talk about healthcare reform is the spiraling cost of healthcare, but as you see the numbers in front of you, again, Americans are more likely to say that healthcare reform would increase the cost of U.S. healthcare than say it would decrease it. And look at the same question we ask about you personally. About a third say it wouldn't make any difference, but of those who do say healthcare reform would make a difference, they're more likely to say their own personal healthcare costs would get worse rather than better. Bottom line out of all of this, I think probably the most important point is there's just not a huge groundswell of enthusiasm about the impact of healthcare reform for any situation in America. We don't find over half of Americans saying that even access to healthcare across the country as a whole would improve. But Americans are certainly more likely to say healthcare reform would help the U.S. in general than for them personally, and that's a real key as far as the average American is concerned. It looks like, based on these data, there is some fear that healthcare reform would be a net negative for their personal lives rather than a net positive. I'm Dr. Frank Newport, Editor-in-Chief of the Gallup poll.